The death roll in the United States, the death rate in the United States, especially when compared with other nations, is unacceptable, isn't it?
Excuse me, sorry, sir. Yes, of course. I mean, a death rate at that high is something that, in any manner or form, in my mind, is unacceptable.
And Dr. Fauci, the experience of other nations shows that the U.S. death rate is not only unacceptable, but it's unnecessary. Isn't that correct?
I don't know if we can say that, Senator.
But would you
I
say
mean,
that the U.S. has to do better?
Of course, you always have to do better. I mean, as a physician.
And the experience of South Korea shows that how a nation manages the healthcare crisis has a huge impact also on its economic condition. Isn't that the case?
That is the case, sir. I understand where you're going with this, but I have to tell you there is a big difference between South Korea and the United States and the nature of the outbreak.
And let me get to that. I want to get to factors that do explain the difference, since we know it's not resources or our health providers. First is testing. South Korea began aggressive testing much earlier than the U.S. Now, in the 5th month of the pandemic, we've surpassed South Korea in per capita testing. But in the critical month of March, South Korea was testing its population at a rate of 40 times the testing in the U.S.